Hi, and welcome to Journey Forward with Jory Rose, where you will gain insights, tools, and inspiration to get unstuck and live your best life. Jory is a licensed marriage and family therapist with a passion for helping people cultivate awareness and authenticity so they can show up fully in all aspects of their life. And now, here's Jory.
Hey everyone, welcome to this week's episode of Journey Forward with Jory Rose. I am so excited for this conversation. I am with Lori Brotto, who has written the book Better Sex Through Mindfulness, which is, first of all, Lori, amazing title. I absolutely love the title. And it's a resource I've been sharing with my clients for a handful of years. So I'm really pleased that you're here today. Thank you for spending some of your morning with me. Please introduce yourself and tell our listeners a little bit about your journey before we delve into the content of this book that so many women need to hear.
Yeah. Thank you. First of all, thank you so much for this opportunity. And thank you for the work that you do in sharing this wonderful information with indeed so many people who can benefit from it. So, my sort of entry into mindfulness was as a clinical psychology resident. I was at the University of Washington in Seattle and had an incredible opportunity to work with Marsha Linehan learning dialectical behavior therapy, which essentially is a skills-based set of therapies that are really intended to help people navigate extreme roller coasters of emotions and kind of the ups and downs in relationships and ups and downs in knowing who you are, etc., and can be a really distressing and in some cases even devastating issue to cope with because of just how rapidly those emotions change in the course of not just within a day, but within an hour or even minutes. And so, what I learned about DBT or dialectical behavior therapy is that one core component of it is mindfulness, and that mindfulness as a tool to really help people tune in and be with and stay with all of the intensities of their emotions was far more effective than distraction or ignoring or going somewhere else. So I found that that therapy to be very, very compelling. And at the same time, I was doing research on sexual health. I had done research on sexual function and sexual health for my PhD in clinical psychology. And at the time, I was doing research with cancer survivors who, following their treatments, really described very devastating changes in their sexual response and arousal, feeling disconnected with their bodies, feeling quite betrayed by their healthcare team for not forewarning them about some of those changes. And as a result, ups and downs of emotion. So on the one hand, gratitude that they were alive and that they survived cancer. And at the other hand, very devastated about this profound loss to their quality of life. And it just sort of dawned on me that this tool of present moment, non-judgmental, tuning in, being with every sensation might be useful for this group of cancer survivors to help them cope with some of the sexual difficulties after cancer. So as I learned mindfulness, I started going to groups, reading everything. I got a teacher. I started meditating daily. And in turn, I was relaying what I learned with this small group of gynecologic cancer survivors. And that really provided some of the foundation that there was something in it. There was something to this tool of paying attention to help them suffer less, most importantly. And a consequence of them suffering less was that they actually did notice sensations, sexual arousal and sexual desire sensations. So that planted the seed. That was 20 years ago. And we've been focusing on mindfulness interventions for various populations of individuals, mostly women, who experience sexual difficulties ever since.
It's so brilliant on so many levels. I did training MBSR with John Kabat-Zinn in 2012, and to see where the research has gone from what he began over 40 years ago and the multitude of applications it continues to be applied to is so beautiful to see the shifts that we're able to create in helping people suffer less by staying present. Because like you said, distraction, ignoring, denying, resisting is a go-to strategy. And that's exactly what it is for many people, as a strategy that doesn't actually work to decrease the suffering and the pain that they're in. And as women, we have such a confusing relationship to sex in our bodies. Mm-hmm. And by society standards, and especially after having children, and our bodies don't feel like ours anymore. And do we feel like sexual beings? And the paradox of narratives and paradigms that get put on women. So it's understandable, even beyond what you did your original training with gynecological patients who've been going through cancer treatments, the everyday average mom. I mean, I can't tell you how many of my clients, and I'm sure you can understand in your practice as well, how many women are like, you know what, I'd be perfectly fine never having
sex again. Yep.
At like 40 years old.
Yeah. Yeah.
And
yeah.
It's so sad.
Yeah.
And yet so common.
Yes.
So can you share some of what you found in the book? Because I love the research you present in the book. And please, there's so much. And I know we're going to try to pack a lot in, but for those who are listening right now, who are in the group of, I couldn't care less about sex, I don't have time for sex, none of it feels good, I'm not interested.
Yeah. First of all, those are all really common. And that's why I could, mind read your sentence and finish it for you, because it's so common. First of all, it is important to differentiate normative and adaptive changes in sexual response that can be fully explained by having a baby, a significant stressor in your life, severe relationship discord, just having had surgery, etc. And so we want to make sure we don't pathologize or label someone who has lost an interest in sex due to one of those maybe short-term issues that have happened. Really what we're focusing on are people with more long-standing issues. My main area of focus, and certainly the focus of Better Sex Through Mindfulness, is on low desire because it's the most common of the sexual difficulties. But we also see problems reaching orgasm, or pain with sex, or lack of sexual satisfaction, or discrepant interest in desire from a partner. So it becomes important that, first of all, we understand what the underlying causes are, so that we don't pathologize the person who has no desire because they're staying up all night taking care of a new baby. And instead we look at, what might be some of the other underlying causes. So what the research tells us is that for many, many women with low desire, chronic stress, anxiety, worries, other mood struggles, whether it's a full-blown depression or even subclinical depression, etc., fatigue, lack of energy, are pretty major contributors to low or absent sexual desire. So first and foremost, we want to make sure that we're taking care of those things. So if it is in the context of a depression, the person is adequately cared for, that they're given skills and treatments to address the depression. Because of course, in depression, one of the key features is apathy, lack of interest. So of course, you're not going to be interested in sex. Now, I should say there's a tiny segment of people who, while they're depressed, they have the opposite. They have quite high levels of sexual interest. So we just want to keep that group in mind as well. So definitely mental health struggles are a major contributor. We also know, and there's been a beautiful amount of research that's looked at what actually happens in our minds during sexual activity. And there's a gender difference. Women are far more likely to, number one, have negative thoughts about sex. Will this hurt? Will I smell? Will I reach orgasm? If I don't, will my partner leave me? Et cetera, et cetera. So these quite negative sexual beliefs, and more common in
that group of negative beliefs. How much does the research show is insecurity about their physical body, how they look?
Huge.
Are they
huge?
I think that, do I have my cellulite? Is my stomach rolling? Do my breasts look okay? Is my chin, like all of
that. All of those things, negative, negative beliefs. And then so you can imagine those beliefs don't live in isolation. They affect how you feel in the moment. So feeling insecure, feeling embarrassed, maybe even feeling anxious. And then the kind of behavioral counterpart of that is pushing a partner's hand away, digging your elbows into your side so the partner doesn't touch those parts of your body that you feel low security about, etc. So definitely huge range of these negative beliefs, but there's also mind wandering. So benign,
Hmm.
not necessarily negative or judgmental beliefs, but just, I mean, the research on mind wandering is fascinating. I've recently really delved into it to look at what can it teach us, and it's it's fascinating and a bit
That
disheartening as
sounds like a
well.
whole other podcast
It
episode,
is.
Lori. I think I'll have to invite you back because that's
Yeah. Just the
huge.
kind of the benign places the mind goes. Did I turn the stove off? What's am I making for dinner
I
tomorrow?
was just going to say, what am I making for
Planning the
dinner?
dinner party, all of those sorts of things. So at the end of the day, what we see is that, again, there's a bit of a gender difference here, a significant gender difference, where women are spending more time really not in the present moment. They're not sensing arousal. They're not paying attention to sensations as they're arising. They're either in a quite a negative place, tends to be future oriented. What if this happens? What if this doesn't happen? Or their minds are just wandering to non-sexual places. So because of that, and because that brain body connection is so critical for sexual response,
Mm,
it's not just a reflex. It is not the case that, if you just kind of touch the pleasure center long enough, hard enough, fast enough, that she experiences arousal. That is not the case. It really requires brain input in order to fuel that sexual arousal response. So that's why brain mechanisms are so important for sexual satisfaction. And hence, mindfulness is so important for sexual satisfaction.
my couples therapist during towards the end of my marriage, she had said that the brain is the biggest sex organ.
Yeah,
And that was
100%.
eye opening to me at the time of,
Yeah,
oh, okay, that makes so much sense.
yeah, it really is. But we don't spend enough time there. We spend, I often say, your body is having sex. Why not invite your mind along to the party too?
Mm.
Instead, minds are elsewhere. They're everywhere but tuning in.
Yeah. And before I have so much I want to ask you, but where does those who have had sexual trauma come into play with this? I know you talked about
Yeah,
the one group of people who've had gynecological medical challenges and overcoming what their physical body has betrayed them. But what about when
yeah,
the betrayal came from a partner, even perhaps someone they actually love, not just a
yeah,
perpetrator? And so, what does the research show regarding how to bring the mindfulness into safety from what was
yeah.
once not safe?
Yeah, yeah. So first of all, there has been quite a lot of research looking at the sexual consequences to experiencing sexual assault, either as a child, adolescent, adult, the nature of the sexual assault, et cetera. And on the whole, that research points to negative impacts on sexual function. Not for everyone, not for every survivor of
Sure.
sexual assault, but on quite a few of them. We did a study a number of years ago, specifically on survivors of childhood sexual assault who were now in a happy, consensual relationship. They wanted to have sex. And every time that they did, their arousal would actually trigger a flashback, dissociation. It would kind of bring
Mm.
them outside of that pleasant encounter and back towards an unpleasant encounter. And so we did a study comparing a group mindfulness intervention versus a group cognitive behavioral therapy intervention, and found that only the mindfulness group, number one, allowed them to stay in the present moment and really stay
Mm.
rooted in the arousal. And then as a consequence of that, their distress was extremely low compared to the other therapy intervention group. So definitely for a person who has sexual difficulties in the context of a history of sexual abuse, I would argue that mindfulness is not only a really important tool, it's probably an essential tool for kind of reconnecting the person with the safety
Yeah.
of the present arousal.
It's huge because, again, if the mind is going to keep wandering and the women's mind are going to be in those negative thoughts, and we could easily, instead of the future orientation, go to the past orientation as
Yeah.
well as a protective mechanism to not be present.
That's exactly right. Yeah. Yeah. So I would advocate for that. It's interesting because, I think 20 years ago, at least when I started reading the research on mindfulness, there were all sorts of cautions and concerns about not using mindfulness for a person with a history of trauma or a person who has dissociative experiences. It might not be safe for them. And the research has really advanced to the point where it's actually recommending mindfulness in the hands of a skilled provider, guiding that person to really use mindfulness as a tool to stay anchored in the present moment.
I love that. I just want to add to the listeners how I qualify that. If mindfulness is the practice and then meditation is the foundation of that practice, for sometimes those who have experienced that physical trauma, sexual trauma, where the body hasn't been a safe place, I will always guide a meditation of external focus of attention first before going into the breath, right?
Yeah.
Looking at something, your hands, your feet, something you see, you smell, you touch. And those often can be a nice gateway into safety in the present moment. Just for those listeners who's ever experienced anything like that, it's a really beautiful way to not feel overwhelmed with going internally.
Yeah, perfect.
So I love in the research in the book that you did talking about women's disconnect from their body actually being in an arousal state where they're telling themselves, nope, I'm not turned on at all. Could you talk a little bit more about that? I think it's fascinating what you did in this. So I would love to have you expand.
Yeah. This research, there have been many different researchers around the world that have tested this phenomenon called desynchrony or non-concordance. Meredith Chivers from Queen's University in Ontario has really been at the forefront of this field. And yeah, essentially what it involves is bringing people into our controlled research laboratory. They go into a private room. For the female-bodied people, they would insert a vaginal probe that measures what does the body do when they're exposed to erotic stimuli. Then they use some kind of a lever to move back and forth to correspond with how turned on their minds are. And study after study after study finds that the degree of agreement between the body's arousal and the mind's arousal is extremely low for women and much higher for men. And it's usually in the direction of, when you're exposed to the erotic content, the body starts to show some signs of arousal, and then the mind is saying, meh, either
That's not doing it for me,
not doing it for me, or even negative. Oh, I don't like the actors, or I don't like what they're doing, or what have you. So
right.
It's almost a normative feature of women's brains during sexual arousal, which, we could talk about, well, how did it evolve to that point? Why is that more common than what we see in men, which is a much higher degree of concordance? But it again points to the role of mindfulness as a tool of reconnecting those. And in our research, that's been something that we have evaluated in all of our mindfulness treatment outcome studies. We've evaluated the degree to which the physical and emotional arousal become more in sync with one another after practicing mindfulness. And guess what the answer is? They do, because that's what we're doing in our mindfulness skills practices. Is we guide the person to really tune into, among other things, but in particular, the sensations in the body. And so then when that happens real time during a sexual encounter, their mind is more present, more able to tune into and experience the sensations, and thus arousal from them.
It's fascinating. I do a lot of work with couples, and one of the things that I see so much is women's disconnect from sexual desire and touch, and actually wanting to engage in sexual practices because of disconnection from their partner, right? Mounting resentment, anger, unresolved issues, communication challenges. They're usually, in the clients that I see, not everyone, but the men maybe not being as emotionally available or present, and so needs not being met. And that brain is going to then create a story about the entire picture. So it makes perfect sense why women come to this opportunity for sexual connection. They're like, that's why I don't have any interest. He wasn't available for me to help with the dishes. Why should I? He loaded
That's
the
exactly
dishwasher all wrong.
Yeah.
And, it's fascinating. And so I'm curious I know you talk about this in the book, but one of the things that I will guide my clients in is practicing non-sexual physical touch, just to enjoy. It's like that sensate touch, practices of just to enjoy the sensation without without attaching any sexual expectation to it. So you can relax into the presence and touch of your partner. Start with
Yeah.
a foot massage while watching TV, something benign that may not
Yeah.
leave. Because I've had clients say to me, I don't even want to hug my husband because I don't want to
Yeah.
give him the indication I might be available for sex because I'm not.
Yeah. That's right. That's
And so
right.
we are depriving ourselves of physical touch, which we know from so much attachment research we crave, we need. It
Yes.
helps us thrive and become healthy and happier
Yeah.
humans. So can you talk a little bit more about just opportunities for couples to engage in that
Yeah.
would
Yeah.
benefit?
I mean, everything you've said, Jory, is completely mirrored in the stories that I hear from clients as well. And it's so interesting that when you ask people, what they really miss most about not having sex or having infrequent sex, they'll say it's the non-sexual touching and caressing and hand holding and touching of the body in an intimate but maybe not necessarily sexual way, because of their belief that a hand on the back means that the next step after that is sexual intercourse, which they don't want to be having because of low desire or pain or other reasons, etc. And so, yeah, your reference to the sensate focus exercise, which Masters and Johnson started in the 1960s, is such a powerful mindfulness tool that couples can
Mm-hmm.
practice on their own at home. And really importantly, by removing the goal of arousal, by removing the goal of sexual activity, it suddenly frees up so much mental space and openness to just feel everything that is there to be felt.
Yeah.
And it tells us that because a lot of people spend so much time in the future, will this hurt? Will I get an erection? Will I get aroused? Will this be disappointing? Will I smell, et cetera? Will the kids walk in? That they are not sensing those sensations. So when they do, when a couple does the sensate focus exercise, and then you ask them to report back, how did that go? Oh my goodness, the descriptions, the vividness, the adjectives that they use about the range and the depth of those sensations. And I mean, this is even in couples that have been together for decades. And they'll
Yeah.
say that I'm feeling touch as if for the very first time. And they are feeling it for the first time because their brain is present. So they really are sensing those sensations for the first time. And then so often they'll say, oh, and I really wanted to have sex after, but you told us that we couldn't. And
Yeah.
that again is so important that we kind of maintain those firm boundaries around sensate focus, because I think it's only when we have those firm boundaries and we say the only goal is a non-goal. Right,
Right.
the intention is to just observe and experience without a goal. And so again, I think having those
Gives
those
them
boundaries or
freedom.
those rules are really important in order to allow them to really feel everything that's coming up.
My partner and I, he brought this to our relationship recently of doing a gratitude massage where for 10 minutes, start someone face down and while giving a massage, gratitude about your partner and
Mm.
do 10 minutes on each side and all gratitude of what you care and appreciate about your partner, and then switch. And so after 40 minutes of touch and gratitude and appreciation for your partner, good luck. Good, you can get through 10 minutes on each side of those partners. But to pair the gratitude and appreciation with the physical touch, because we had broken up for a while and now we're back together. So we're really rebuilding this very deep connection. And it's been amazing. So for those of you who want to practice, that's a really beautiful additional way
I love
to be
that.
able to.
I
Oh, it's
I love that.
beautiful, Lori.
Yeah. Yeah. I think I might borrow that one from you.
Yes, please, 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 please. One more quick question. I know we've got to wrap up in a minute, but I'm curious if in the research you find women are more disconnected at older age or younger age, because part of me feels like I'm 45. So while there might be some more negative stories in my head built up over time, I also know myself better than I ever have and am more
Mhm.
comfortable with myself than I've ever been, and therefore more open in my own sexuality. Whereas when I was in
Mhm.
my 20s, I'm like, what the hell's going on? Like, I have no connection to this, but yet the stories in my head were less at that age, or
Yeah.
distractions and no kids. So do you just
Yeah.
see a difference in age?
Yeah. Yeah. It's interesting when we look at the prevalence or how common difficulties with orgasm, reaching orgasm is, it's inverse related to age, which means that the younger women are have the highest frequency of having difficulties with orgasm.
Hmm.
And the explanation is exactly what you've just said. There's
Hmm.
less awareness of the body, there's more body discomfort and shame, etc. And then with age, there's sort of the, yep, I kind of know what's there. I know it works for better or for worse. So there's that phenomenon. And then the perimenopause is a really interesting stage because
Hmm.
for some women, the amenorrhea, the removal of the fear of conception suddenly frees up their ability to really kind of enjoy sexual desire in a way that they never did during the reproductive years. What's one subgroup of women. But then, of course, there's the impact of the negative impact of the symptoms, waking up at night from night sweats or hot flushes, or pain with sex due to fluctuating estrogen levels, changes in your body, having more fat retention in the abdomen, et cetera, can make sexual desire and sexual arousal more challenging. But
Yeah.
it's definitely a period of time where women have a heightened sense of what's happening in their body, which if we could channel that and translate it into kind of sexual interoception being when we know what's happening in our body, then when women kind of transition and come out on the other side of perimenopause, it can be an incredible time of rebirth in their
Yeah.
sexual response and sexual satisfaction. So yeah, no,
Ah,
there's definitely no cookie cutter answer, but
no,
because desire is something that can be cultivated, it's not fixed. It's not at one set level for the rest of your life. It absolutely, the research tells us, can be cultivated. Then that's good news for us. We just
it
need
is.
to adopt those strategies that help in its cultivation.
And I've said for years, mindfulness is the answer to everything. Whether you're sitting in traffic or dealing with cancer, the tools are the same. Like that's been
Yeah,
one of my taglines I've said for years. And so really what we've just described is from, young womanhood into much more mature womanhood, regardless of what your sexual relationship is. Mindfulness is the answer to make
yeah,
it better, to enjoy yourself, enjoy your partner, enjoy your body, the sensations, all of it. So
yeah.
Lori,
Couldn't
I
agree
I could
more.
talk to you. I could talk to you for hours, and really thank you for the research that you've done, because I've known this intuitively right from my own
Yeah.
mindfulness training and my work as a couples therapist, and to have the research that you've done and other teams of people to back up what I see trending and what
Hmm.
I know is the solution is really beautiful, just to have that
Mm.
resource base. So I really, really honor and appreciate your work. And thank you so much. Is there any last thing you'd like to say, or where people can find you?
You can find me on social media, Instagram, Twitter, at Dr. Lori Brotto. And then for anyone who's interested in our research, it's brottolab.com. And then I actually have a free downloads of our meditation, our mindfulness meditation links on my own website, which is loribrotto.com, if anyone wants to download those and give those a listen.
And we'll have those links in the show notes. Lori, thank you so much. I do hope to stay connected with you. And
Absolutely.
if you ever have more things you'd like to share, I'm always an open platform. I would love to connect further.
I would love that as well. Thank you so much for sharing this information with the public.
All right, everyone. Hope this was all valuable. Hope you all take care and be well.
To continue your journey forward, find Jory Rose on Facebook and Instagram to become part of her growing community. You can also gain access to her meditations, books, online classes, or to sign up for an upcoming retreat. Visit her at joryrose.com. That's JOREEROSE.com.